Diabetes, a name that everyone has heard of, but not everyone truly understands this disease. To begin today's journey, let's imagine our body as a machine running smoothly thanks to perfectly connected gears. Among them, insulin is the important key that helps deliver energy, that is glucose, into each cell to nourish and sustain all life activities. When this key is lost or no longer fits, glucose cannot enter inside and instead wanders in the blood, increasing blood sugar and gradually breaking down the body's originally complete structure. Diabetes is essentially a group of metabolic disorders characterized by prolonged high blood sugar levels. There are two main types. The first is type 1 diabetes, commonly seen in children or adolescents, where the immune system mistakenly attacks and destroys the beta cells in the pancreas, the place that produces insulin. This causes the body to almost completely lose the ability to produce insulin on its own, forcing patients to inject insulin daily to survive. The second type is type 2 diabetes, more common in adults, especially those with a sedentary lifestyle, diets high in sugar and fat, overweight or obesity. In type 2, either the body is resistant to insulin or the pancreas does not produce enough insulin, causing glucose to still not enter the cells effectively, leading to high blood sugar. More worryingly, the trend of type 2 diabetes in young people, even children, is increasing due to the influence of modern lifestyles. So, why do we need to detect diabetes early? The answer lies in proactively preventing dangerous complications, improving quality of life, and saving long-term treatment costs. Many studies have shown that early detection and good control of diabetes can reduce the risk of heart attack by up to 40%, nerve damage by 60%, and blindness by 70%. Especially if in the pre-diabetes stage, when blood sugar has just slightly exceeded the normal threshold. Making reasonable lifestyle changes can completely reverse the condition without the need for medication or worrying about complications. Additionally, modern medicine now offers many safe and effective drugs that help improve insulin sensitivity, support weight loss, and protect the cardiovascular system for patients. Let's together recognize the early signs, seemingly mild but actually silent warning bells of diabetes. First, there is a constant feeling of thirst and frequent urination during the day, especially at night. When blood sugar rises, the body tries to eliminate the excess sugar through urine, pulling water from the cells, causing dehydration, dry mouth, and unquenchable thirst. Along with that, you may notice unexplained weight loss, even though you are eating normally or even more. This is because the body cannot use glucose and has to burn fat and muscle for energy instead. A prolonged feeling of fatigue and exhaustion, even without excessive activity, is also a common sign. The cause is that the cells do not receive enough energy, making you always feel sluggish and lacking vitality. Some people also experience reduced vision, blurred eyes, and headaches due to increased blood sugar altering the fluid in the eyes, affecting the retina. In particular, small wounds take longer to heal than usual, are prone to infection or frequent recurrence because high blood sugar reduces resistance and hinders the tissue recovery process. In addition, numbness and tingling in the hands and feet are warning signs of peripheral nerve damage, which appears after a period of poorly controlled blood sugar. In women, menstrual disorders, vaginal yeast infections, or gynecological problems may occur. In men, erectile dysfunction and decreased sexual desire are also symptoms that should not be overlooked. Some people also notice dark patches of skin on the neck, armpits, or groin. These are signs of insulin resistance, commonly seen in prediabetes or type 2 diabetes. So, who is at high risk of developing diabetes? First of all, those who are overweight, especially with abdominal fat accumulation. Next are people with a family history of diabetes, those over 45 years old, people with high blood pressure, lipid disorders, women who have had gestational diabetes or given birth to babies weighing over 4 kilos. In addition, a sedentary lifestyle, frequently eating processed foods, high in sugar and fat, also increases the risk of the disease. Some ethnic groups, such as Asians, Africans, and Native Americans, also have higher rates of diabetes. If you find yourself in a risk group or have the above signs, take action today. The first step is to have a general health checkup and undergo tests such as fasting blood glucose, HbA1c, or glucose tolerance test. Don't hesitate to record any unusual symptoms using an app or a health diary to track your health daily. At the same time, start making changes from the smallest things. Eat more green vegetables, low-sugar fruits, limit refined sugar, cut down on soft drinks and sweets, and increase physical activity such as walking, yoga, or swimming. If necessary, you can consult a doctor about using supplements like magnesium or alpha-lipoic acid to help control blood sugar. Don't forget to have regular checkups every 3 to 6 months to update and adjust your care plan accordingly. In particular, there are cases that require immediate medical examination. If blood sugar is above 240 mg/dL, accompanied by the presence of ketones in the urine, or if there are symptoms such as sudden vision loss, severe numbness, swelling of the hands and feet, nausea, confusion, or difficulty breathing. These are dangerous signs that can be life-threatening if not promptly treated. In summary, listen to your body and recognize early signs of abnormalities such as excessive thirst, frequent urination, unexplained weight loss, fatigue, blurred vision, wounds that heal slowly, numbness in hands and feet, physiological disorders, and dark patches of skin. Don't hesitate. Schedule a checkup as soon as you notice any signs. Subscribe to the Pure Wellness channel to receive useful health information every week. Don't forget to share this video with friends and family because you might help save someone's life. Thank you for taking the time to follow today's content. Remember, early recognition, timely action, living healthily. If you find these shares useful, please like, share, and leave a comment about your own experience. Wishing you always health, happiness, and strength on your journey to living healthily every day.